Cancer treatment comes with physical side effects. Some of the most common are pain and fatigue. Even though they're normal, they're distressing. It is understandable to feel discouraged. We often wish we could make these things go away, but we may not be able to get rid of them entirely. Then it becomes about adapting and managing the pain and discomfort. Before we get into some of these things, I want to mention that talking about your pain with your medical provider is important for coping with it. There are pain medications and changes in medications that are sometimes very helpful. Our palliative care team at Tennessee Oncology is great at helping with this. I think everybody should explore other ways to manage pain too. So these techniques are things you can use in addition to pain medications or on their own. Some of these things will work for you, some will not. Managing pain is about trial and error. It takes persistence and courage. Rarely do these things work immediately or first time, but they do work. Let's check out a few of these strategies. After talking with your medical provider, there are a few things you can do to help reduce pain levels. A big part of managing pain is listening to your body and figuring out what you can do and what you absolutely cannot do. Finding out where your pain limits are and learning to respect them is important. At the same time, maintaining exercises that are approved by your medical provider is a really good idea. This does not mean pushing through pain limits. Self-encouragement works better than pushing. All this means is that the surest way to magnify chronic pain is to stop moving. Keeping active, even just a little bit, keeps pain from running your life. I mentioned earlier that understanding pain limits and how your body feels is important, but that does not mean sit and think about how bad you feel. It can be helpful to distract yourself from pain in healthy ways. This can allow you to recharge a bit and experience some joy or focus on something other than pain. Our minds feel less pain when we are laughing, focused on completing a chore, engaged in a hobby, or watching a favorite movie. And try to stay socially connected whenever you can. People feel better when they're in a community, even when they're in pain. If you're stuck in a pain loop, try disrupting it with one of these things. I find that people can be skeptical about this, but the pain that we feel can be influenced by our state of mind. Learning psychological tools to deal with this pain can keep pain from running your life. Try going through a workbook on managing pain. It is often most helpful to meet with a mental health therapist that uses a cognitive, behavioral pain management approach to treatment, like we do here at Tennessee Oncology. People report a decrease in pain when they learn and practice pain management tools. You can use these tools in all sorts of situations. They're the gift that keeps on giving. But I would not just take my word for it. Try it yourself. A lot of people have fatigue, being tired, low energy during their cancer journey. This is expected. You will not have the same level of energy as you used to. It's tough, and it makes sense that a lot of people are upset when this happens to them. One thing to practice is acceptance of where you're at right now. Trying not to compare yourself to your old self. The you that is in chemotherapy, taking cancer treatment, medication, or going through radiation is just going to have more fatigue than the old you. Instead of spending time thinking about comparison, try to remember that this won't last forever. Focus on adapting to the life that you have right now. Many people think fatigue is a sign that something is wrong, but it can also mean that your body is using resources to heal. Feeling fatigue may just mean that your body is working hard for you. Reminding yourself of this may help relieve stress about your fatigue